Hey, I'm Dr. Joe Nyamtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do cosmetic facial surgery from here to here. I don't do boobs, bellies, or butts. I'm a teacher, I'm an author, and I'm a surgeon. And I love going to work. I love what I do. So today we're going to talk a little bit about recovery. And one of the first questions that any patient has when we do a consultation is, hey doc, what's the recovery? What's the recovery for my eyelid surgery or my deep plane facelift or whatever procedure that we have to be doing? So unfortunately, there are a lot of surgeons that sugarcoat the recovery, and the recovery may be 2 weeks and they say, oh, it's 5 days, you'll be fine. And at 5 days, you're not fine. And you're trying to go back to work, you're trying to get back into life, and you're swollen or bruised or whatever. So number one, surgeons have an obligation, an ethical obligation, to present the true recovery window to their patients, okay? And if they don't, that's unfortunate. 60% of my deep plane facelifts and our practice in general are from out of town. So we have a lot of patients that fly into Richmond, Virginia for surgery, and they've seen other doctors, and so I get to hear what they were told or see their treatment plans. And many, many times, they were really told a underestimation of how long their true recovery is. And when I say, well, that it's going to take 2 to 4 weeks for you to fully recover, they're going to say, well, gosh, the other doctor told me it was 4 or 5 days. And I said, well, that's not going to happen. So let's talk about recovery, all right, and what it means to myself as a surgeon and my team, and what it means to a patient. So for some patients, recovery may mean, when can they walk to their mailbox? To other people, it may be, when can I put sunglasses on and sneak to the mall? To other patients, it may be, when can I go back to work? And for other patients, it may be, hey, my daughter's getting married. This is going to be the biggest event of my life. What's my recovery? Those are 4 different answers, okay? Now, obviously, recovery depends on how many procedures you do and what you're doing, right? So if you do just say upper eyelids, that's going to be a much shorter recovery than if you do upper lower eyelids, brow lift, cheek implants, deep plane face and neck lift, and a laser. That's going to be a bigger recovery. So for instance, when I do eyelid surgery, people say, how long, what's the recovery? I say, well, the initial recovery is a week. In other words, most people are going to take a week off from work. If you have a week and a weekend, that's even better. During that time, you can't do any heavy bending or lifting. But it's not a week before your class reunion, okay? And I tell patients, so, if you have some big event, give yourself 4 to 6 weeks. Same thing with facelift surgery. People say, and we do, I did 109 facelifts last year, so we do a lot of them, and patients say, well, what's my recovery? Okay. So again, does that mean when you can drive? Does that mean when you can go back to work? So the short answer is 2 weeks. All right. And that means that by 2 weeks, most people are going to want to get out of their house. All right. And they're going to get out, and they can usually cover things with makeup. And, I tell them again, if you have the cruise of a lifetime or some huge event, give yourself, 6 to 8 weeks when you're doing multiple procedures. You have patient variation, and this is the thing that the patient doesn't have control of, the surgeon doesn't have control of. It's all about Mother Nature, okay? So I can do the same procedure, with the same instruments on the same group of patients, and some of these patients, 3 days later, they look great. And you're going to have one that looks, still is bruised and swollen at 3 months. So there's a lot of variability, and we know people that are redheads or real light skin, they may swell or bruise more. So that's something that you can't control. You can have the best patient in the world, the best surgeon in the world, then you have Mother Nature, okay? So when you're talking to a surgeon and you ask about recovery, you want to be very specific, and that will give you a more accurate answer. So I want to mention that we do not routinely use drains. A lot of doctors use 1 or sometimes 2 drains and leave them in a week. The only time we use a drain is if a patient has a lot of oozing during surgery, and some people just bleed a little bit more, and by putting a drain in, you can help their recovery and their bruising. But Nobody likes drains, and we don't use them probably on 10% of our patients or less. Also, in terms of dressings, a lot of doctors use big, bulky football helmet type dressings. We don't do that. We just use what we call a jaw bra. It's a Velcro dressing that you wear overnight, and usually the next day we'll change the patient to a very light ACE bandage or a little elastic bandage just to help support, and they can wear that off and on for the next week. And now we're going to show some interviews of patients after surgery, after deep plane face and neck lifts. Some of them may have had eyelids, implants, laser, and such. And we're going to look at patients 24 hours after their deep plane procedure, 5 days after a deep plane procedure, 2 weeks after, and we will interview these patients and show their incisions and talk to them about their recovery. And one of the biggest joys for a surgeon, and really the patient usually as well, is the morning after surgery, okay? Because that's when everything comes together and you take the bandages off and you can see what you've got. So our patient here has just been a joy to work with. You know, good patients, they come educated, they look at all my videos, they study my website, they understand the procedure, and they do all the steps that they're supposed to do. Because you can have a really good surgeon, but if you don't have a compliant patient, then that's a problem. And we have an excellent patient. So here we are, less than 24 hours. We did a deep plane facelift and deep neck lift yesterday. So, and we did lower lid laser as well. So how was your night?
It was, I was actually comfortable. The worst thing about it was, and it wasn't even that bad, was the just getting my shoulders in the right position and keeping them there. But once I got stable, I didn't feel any pain. It was nothing like what I was anticipating. I didn't know what to anticipate, but it was great.
Great. Were you able to sleep?
I did sleep.
And how was the discomfort?
There really wasn't a lot of discomfort. If anything, I felt a little bit of a sore throat from the anesthesia.
Correct.
But that was the extent of my discomfort.
Well, great. That's awesome. And that's how we want all our patients to be. Recovery is variable. You know, some people have an easier time, some people have a harder time. The more procedures you do, the more complex the recovery can be. When she talks about her shoulders, you know, when you do all this surgery on the neck, you do have swelling and you do have some discomfort there, but you know, you're able to find a position. And we allow our patients to lay down flat the night of their surgery. Now, we did not use any drains here today. And so what we're going to do is we're going to come back in a second. We're going to show you her incisions, and then maybe we'll take a look at her a little later down the road in her recovery. So we use only dissolvable stitches, and we hide the incisions in the hairline. So that's hidden in her sideburn. This incision is hidden in her back hairline. There's stitches behind there, and these will all dissolve. So we look at her profile is beautiful. She has no fluid or blood. Her flaps look nice and pink. So everything looks really good there. We'll take a look at the other side. So again, dissolvable stitches. There's still that little blue is from the surgical marker. And again, we want to hide this in the hairline so we don't change her sideburn at all. And our incision goes around here and back into the hairline. She has a very, very tiny tragus. So we elected, as we frequently do, to do a pretragal incision. Otherwise, it could really shrink that and make it look unnatural. So I'm just really excited and happy about this procedure, and so glad to have such a great patient. And you know what? This is why I just love coming to work. I do it.
Well, the big thing for me is trust. And I trusted Dr. Naim too implicitly from the get-go, from my first appointment. And that's really what sealed it for me. I knew right away that he was going to be my surgeon. And I think the only other any anxiety that I had at all about this procedure was what would the first night be like right after surgery. And I was really surprised that I wouldn't say it was a breeze, but there was very little discomfort.
Well, those words humble me, and I'll tell you what, it's equally my honor to be your surgeon. The two things that we have to do for our patients. Number one is patient safety, and that has to do a lot with the trust situation. Patients come here, we have a fully accredited surgery center, we do full-time, we have a full-time anesthesia provider, and we did 109 facelifts last year. So the other part of that equation is predictable outcomes, okay? She has to look natural. It's her face, it's my reputation. If she doesn't look good, I don't look good. So thank you so much. You really honored me with those words.
Thank you, Dr. Niamtu.
Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. And as you know, if you follow us, this is one of my favorite things, is seeing my work 24 hours later. On this great patient who came to Richmond, we did a deep plane face and neck lift and a deep neck lift, and we really did a lot of work on the neck. And I think we're giving her a profile that she's probably never had or hasn't had for a long time. So I'm really excited about it. You peeked in the mirror. What do you think?
I think it looks great. I thought I'd have more swelling and bruising. I don't. I don't really have any pain, just a touch soreness, but not even in the category of pain. Just feels like something, like a hard workout of my neck is what it feels like.
And she's done great. Oh, I forgot to say, we also did her upper and lower eyelids and a canthopexy to tighten her lower lid. And we lasered her lower lid, so that's what that's all about. But, you know, recovery is variable, and this is, I think this is as good as it gets, you know, when people just feel this great after surgery. Matter of fact, sometimes they feel so good, you got to hold them down because they're gonna want to be too active. Did you think it was going to be worse than this?
I thought it'd be more swelling and more painful than it is. It's not, like I said, not really pain. It's just a slight stretching feeling on my neck muscles. I think what was really helpful was all the videos that you recommend watching in advance. I watched them a couple of times. My husband, who's my caregiver, also watched them, so we knew what was happening. They were very clear and helped me also make my list of things that I needed to make sure I had on hand post-surgery. I think that's the ticket also, the education and the preparation.
Well, I'm glad that helped. And we have over 23 million views on our YouTube videos, and it seems like I'm always just making videos. I spend a lot of time on it, but it's funny because a lot of people that have facelifts elsewhere send me a note thanking me for watching my video.
I believe it.
And I said, well, you should have come to Richmond.
Yeah.
All right, well, anyhow, thank you so much. You're a great patient. It's going to be a great result. I'm really excited to see this as it matures. And we'll take our final pictures at about 3 months. So here are our incisions at 24 hours, and obviously her hair is matted because we washed it after surgery. But the incisions are going to be hidden in her hairline, and her earlobe is a little swollen, but that's going to look great. And she's not going to have a blunted tragus. And sometimes people ask me, why do you make this incision in the front? Sometimes we do it in the back, but I get my best results with this type of curvilinear incision. Same thing on this side, sideburn incisions hidden in the hair, posterior incisions hidden in the hair. Her earlobe is swollen, but it's nice and in a normal position. And once again, somebody's going to say, oh, you shouldn't put the incision there. Well, if you don't think you should put the incision there, go look at my webpage and look at my scars and look at my videos on facelift scars. It will look excellent. You'll never know she had it, and she'll never have a blunt tragus, which sometimes happens if you go behind there. Again, one of my favorite spots right here in this room. We are 5 days after deep plane facelift, deep neck lift with digastric muscle reduction and submandibular gland reduction. And we lasered some brown spots and some moles, so those are still a little bit angry. And at 5 days, we're looking really good. I'll show you her before pictures. And the reason we're videoing today is she's going back to Connecticut. And I'm so honored that almost 60% of my patients are fly-in patients. They're from out of town. And that's a big honor for me. So tell them about your experience.
Well, it's been great. As soon as I got out of surgery, I felt like I looked much younger and much tighter, and I feel great. Besides being a little bit swollen.
Yeah, and she's sore. Okay, you know, and She asked me what we did to her neck. It's so sore. Well, we did liposuction. We did a deep plane neck lift. Does a lot, but boy, it's just gonna be so nice. So you've been a great patient.
Thank you.
And you get to go home a little early. Usually we like people to stay about a week, but if people are doing well, then they can go home a little on the early side. So what was it that kind of prompted you to pull the trigger and get this done?
Weight loss. I lost a lot of weight, and then I felt like my neck was loose and wanted to kind of pull everything back up.
Okay, very
Yeah.
good. All right, well, we're going to take a look at her incisions, and we'll be back in a second. So here's our incisions at 5 days, and we hide the sideburn incision in the hairline, and I have that incision, which is healing well. These are all dissolvable stitches, and I know some people are going to say, oh, you didn't go behind the tragus, and we do very well when we go in front of the tragus. She's got a pretty small tragus, and if you blunt that tragus, it is a deformity that will be there forever. This will be an imperceptible scar. Her earlobes are swollen. Her incisions go behind her ear, and then they're hidden in the hairline as well. We'll show you the other side next. So same thing, we have her incision hidden in her hairline in the front, and in the back, her hair, she's got some Vaseline in her hair here from taking care of her incisions. Then, of course, she has the incision around the back, and all these stitches are going to dissolve, so she's not going to have to go home and worry about having to get stitches out. Again, her lobes are swollen, those are going to go down. So I think it's going to be a great case. She has some bruising, and this is where we took off some moles. And you would expect bruising and swelling at 5 days. So I'm very pleased with the way she's healing. I think it's going to be a home run. So here we are, 1 week post-surgery, and my friend's getting ready to leave town. She stayed with us for a week. She doesn't live too far away, so she's going to come back next week for her 2-week appointment. We have a couple staples in there and some sutures that we're going to get out. But you're looking really good, so tell me, how did the week go?
The week went good. The first 3 days were pretty, uncomfortable, and I definitely couldn't do much. But overall, I mean, it was shocking to wake up and see so much skin gone. And even with the swelling, I've been showing my friends, and they're like, "Your surgeon's a perfectionist." It was shocking to see. Even with the swelling, I can see my jawline again. But I feel great. It's day 6, and I haven't taken any pain medicine in like 4 days, so it's going pretty well.
Well, good. And when patients look in the mirror after surgery, and you can see the results right away. You can see it, when they wake up, a lot of the preliminary results. But as good as you feel, because that skin is gone, I'm proud that I was able to do that for you, and I feel just as good. So it's going to be a great case, and we'll come back and we'll look at her at 2 weeks. And I think it's important for patients to see what people look like the day after, a week after, several weeks after. So we're going to show you her incisions, and we'll be right back. So she has done such a great job of keeping her incisions clean. And the surgeon can do a lot, but the patient has to do a lot too to make everything successful. We have hid her sideburn incision in her hairline, and her back incision is going to be hidden in her hairline. This is going to do well. Sometimes people ask me in my videos, why didn't you make the incision back here instead of here? Well, there's a lot of factors that go into it. She has a very tiny tragus, and if you make the incision there, that could kind of dissolve some of that cartilage, and it's just a stigma of facelift. This is going to heal so well that you'll never see that. So, and this is the incision behind her ear. Let's go look at the other side. Okay. Same thing, we hide these incisions in the hairline, so you're not going to see them. That's the back incision. She has a couple staples there. The rest are her dissolvable sutures, and she's keeping that really clean. So it's going to be an excellent result, and we'll come back and look at her in a week. Hi, I'm Dr. Joe Niam to LoveThatFace.com. This is our friend Linda. She is 2 weeks out of deep plane facelift with deep neck lift and buccal fat reduction, and we lasered some little pooches right here. Yeah. So you have some bruises there, I see, but tell me about how's it been so far?
Oh, it's been great. It's been great. I'm so happy. I didn't go through any strange emotions at all. And my husband last night out of the blue, he hadn't said a thing, and he turned to me while we're watching TV and said, "You know, your face looks really good." And it's hard for me to believe it's only been 14 days.
Well, you know what? That's great. And what I love when patients come in, and we're going to put her before pictures up so you can see them, and you go like this and you can't grab any skin, you know, tell her that she looks as good as she did when she was a sophomore in high school in terms of that skin. Now, you're very full right here because of the surgery. And when you do deep plane surgery, it's a little bit more involved, so sometimes you get a little bit more swelling. But for 2 weeks, she's really doing great. She does have some bruising. And you told me you could talk about your age.
Oh, I don't mind a bit. I'm 72, and I
Okay.
can't believe it myself. But I'm 72, and I did this because if I don't do it now, when am I going to do it? And when I think back to things I've done for myself over my life, I think I needed to do something for me versus someone else, you know? So I went for it. And the way it's made me feel in just 14 days, it's actually going to be a gift to others because I feel better about myself. I'm going to treat everybody else better.
Okay, you're making me feel great. It was my honor
It's
to
just
be your
true.
surgeon.
Thank
And if anybody asked you about a facelift, what would your advice be?
I'd say, love that face and call Dr. Joe.
They're going to think this is a commercial.
It's not really. I'm just so happy.
You know, we're so lucky to have patients, and I love. So 60% of our patients are from out of town. They fly in, but I love really people that are excited, that are passionate, that smile, and you're a great patient. And what we will do is we'll come back and look at you in a couple months and at your final result. So what we're going to do is we're going to go off camera for a second. We'll come back and we'll show you her incision so you can see how she's healing. So what we try and do is hide all of our incisions in the hairline so you don't see them. A lot of surgeons will make the incision down here. I like to keep it in the hairline. Same thing, I like to keep it in the sideburn hairline so you don't see that. And she's healing well. Now, I know some people are going to say, oh, you made the incision in front instead of the back. She has a very small tragus here. And excuse me, sometimes that will blunt and deform. And if that happens, it does not look good. So on a patient with a small tragus, we go in front of the ear. This is going to heal where you don't even see it. We'll go look at the other side now. So once again, her incision goes back into the hairline. So you won't be, the only thing you'll see that, and that's going to heal great. And she's going to be able to wear her hair up. She has a lot of hair, and that incision is covered. And then our sideburn incision's right here, and her hair will grow back through there. That's looking good. And most people have a crease when you push like that on their ear, and that's where you make that incision. That's going to heal great. So sometimes we go in front of the ear, sometimes we go behind the ear. It depends on the patient's anatomy. It depends on if they have a nice big crease here, and our discussion with what the patients prefer. So she's going to do well, and we'll see her back here soon. Hopefully this has been a good investment of your time, and I think that I have explained the unadulterated truth, the unsugar-coated truth of what you can expect immediately after deep plane face and neck lift, as well as the early recovery periods. If you want to see before and after pictures of these patients or any patients, I have over 10,000 before and after pictures on my website, lovethatface.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I only do faces. I don't do boobs, bellies, and butts. I'm a teacher, I'm an author, and I'm a surgeon, and I love going to work. If you're considering deep plane face or neck lift or any cosmetic facial surgery, contact us at lovethatface.com. I'm Dr. Joe Nyamtu. Thanks for the greatest gift of all, and that's your time.